Hey everybody, it's Dr. Leslie, and welcome back to the series on My Wellness Tribe, where we talk about living well and staying well. Now, this video interview is for ladies only, so you guys might want to tune out. And ladies, you're going to love this. I'm here at Gracepointe Healthcare with Krystal Lynch, and she is their nurse practitioner here. She's a graduate of Vanderbilt University, and her primary focus is on women's health. Now, they have just started offering a new service, and it's called Votiva. You may have heard of it, but you're going to really get some great information today. So, ladies, you're going to love this. You might want to get something to write with, but definitely tune in. I'll tell you, this new procedure is changing women's lives across the country. So, I'm super excited to introduce to you Krystal Lynch. Hi. Thanks so much for having us.
Yes.
Okay, so tell the audience, what is Votiva?
So Votiva is a gentle radiofrequency procedure that we use for sexual dysfunction in women, especially postmenopausal women who have vaginal dryness, itching, burning, painful sex, and then we also can use it for women who have some urinary incontinence issues, stress incontinence. You sneeze or you cough and then some urine comes out. Mm-hmm. So this is the machine, this is the procedure that we use for those symptoms.
Okay, great. How long has Votiva been out? I mean, is this new to the U.S.?
So to the United States, yes. So it was just recently approved by the FDA, and it is the only one approved by the FDA for sexual dysfunction, especially in your postmenopausal women. But this type of technology has been around for years and years, and so we are now kind of falling behind Europe and Canada, but we're catching up.
Awesome. Now, tell us a little bit more the type of patients that typically come in to see this. I know you kind of mentioned some symptoms, but are there any contraindications, like any women that can't do this?
Sure. So my typical woman who comes in, she's either going to be that postmenopausal lady who has some vaginal issues and vaginal pain. And then the other type of patient is going to be the one, like I said, who has some incontinence issues. The ones who are not going to be approved for it are women who have more severe what we call cystocils, and that is where the vaginal wall, where the bladder is too weak. And I don't think that those women are going to be approved just because I don't think they're going to get the results that they want.
Okay, great. So those would be more your surgery
candidates.
Yes. So tell me, this is using radio frequencies, which is fascinating. Now, I know there's some laser procedures out there. So what are the benefits of having the radio frequency over the laser treatment?
So our procedure uses a bimodal frequency, radio frequency. It is going to use a little bit of heat also to help with it, but there is a temperature gauge and an energy gauge on here where I cannot go past it. So there's no way for me to damage the vaginal tissue. There's no way for me to burn the patient, versus some laser procedures can do that because there's not necessarily that safety cutoff.
Gotcha. Now, how exactly is this working? I mean, is this just, increasing more collagen? I mean, how is it that using the frequencies is helping people with their incontinence or increasing more moisture or whatever it is that it's doing?
Right. So the way that the Votiva works, we've got two different layers going on. We have the radio frequency layer, and like I said, it's going to be bimodal where it goes in and out, so it cannot burn the patient. And then number two, we're using heat. And those two combined together are going to increase vaginal elastin and collagen growth, which is going to help kind of tighten up that tissue, the vaginal wall, and make the cells more healthy. Gotcha. And by doing that, we're going to increase the moisture and the lubrication, so painful sex is down. And then also by strengthening the vaginal wall, we help with the urinary incontinence symptoms and even some rectal prolapse symptoms like constipation.
Yeah. That's amazing, I guess, because it's kind of just holding up the bladder at that point. So tell the ladies watching, is there any downtime? Is this painful?
No, this procedure is not, and it should not be painful. There is no downtime. The only thing after post-procedure is no sex for 2 days, and no hot baths for 2 days. And that's really it.
Wow, that's amazing. What are some of the testimonies you're getting back from your patients?
So that has been the most exciting. Most of the women have a difference after the first visit. So when they come back for their second visit, they're telling me, yes, I can tell a difference. I'm not sneezing and peeing anymore, or I've only had one episode of leakage. The painful sex is getting better, things like that. So it gets really exciting.
Yeah, well, I imagine that there are women watching right now that are thinking, oh my gosh, this is incredible. How can they get more information about this?
Sure. So they can come to our website at gracepointehealthcare.com or join our Facebook page.
Okay.
And then they'll get more updates about our women health seminars that will have a $500 coupon for our product and our service here. So that's always really nice when you come listen to our talk.
Great. And your Facebook page is just under Gracepointe Healthcare?
Mm-hmm.
Okay, awesome. Thanks so much, Krystal.
Thanks.
This is really incredible. Ladies, I'm telling you, you should come check out one of their informational seminars. Get on their Facebook page. You're going to want to know more about this procedure. It really is life-changing, and I'm so excited that you were able to tune in today. Thanks so much. Be sure to check out drlesliewellness.com for more upcoming videos. Thanks, and be well, stay well. See you next time.